So some real quick things about the chest wall. So we took off the chest plate, okay? We take that off, flip it over, and on the inside of the chest wall, okay, you can see the internal thoracic as it runs on down. And you can actually see it split, and it'll turn into the epigastric arteries as well as the musculophrenic arteries that'll run around the inside of the ribs here and stay just this side of the diaphragm to innervate the diaphragm. This muscle here is called a transversus thoracis, and it's that muscle that squeezes every time you try to take a breath and cough. And so it's the one that makes you feel like your chest hurts after you've coughed for like 2 or 3 days. So we look here mostly on the right side of the heart. I'm going to take out the lung just to orient yourself. And so we see now the heart. We're going to take that out with the blood vessels to it. Here is the aorta. This is the pulmonary trunk. Okay. Here's the superior vena cava with the left brachiocephalic and the right brachiocephalic. Okay. See here, this is the phrenic nerve. Okay. We're going to take out the other side, and here you have the phrenic nerve on the right side. You can see here that this is the vagus nerve. Okay, it's the left vagus nerve, and it's going to come down and ultimately come down and become the anterior plexus on the esophagus, anterior esophageal plexus. But you can see this little part that's going off to the connection between the pulmonary trunk and the aorta, and the part that reaches around the ductus arteriosus ligament, which is now the ligamentum arteriosum. We call that the recurrent laryngeal. On this side, we're going to move some of this out of the way so you can see the trachea and the bilateral primary bronchi. And underneath them is going to be the esophagus. And you can see here this posterior esophageal plexus, which is being formed by the right vagus nerve. We go a little deeper. Here's the azygous vein, and next to the esophagus, underneath it, this little tiny thing is a thoracic duct, and it's going to go all the way up to the branch between the internal jugular and the subclavian on the left side, and insert there so that all of the fatty lymph that goes in there can be mixed with a large amount of blood. The azygous is primarily all a right side structure, with the superior subcostals also feeding directly into the brachiocephalics, whereas here you can see this is the sympathetic chain, and it has individual little ganglion that give off the vein, artery, and nerve running to each side. You can see this muscle here, and this muscle actually skips a bone. So it goes from that bone, skips that bone, and goes up to that bone. And so that's a subcostal muscle right there. The subcostals are mostly in the back. On the other side, you need to note that this side drains into what's called the hemiazygous. And the hemiazygous and the accessory hemiazygous cross over to the other side, and they're above and below each other. This is the accessory hemiazygous, and this is the hemiazygous right there. They cross over into the azygous, and the azygous goes into the superior vena cava right here.